The Keynote-21G was a cohort of a larger scale study looking at chemotherapy and other combinations with pembrolizumab, and was initially a phase 1 study with a phase 2 expansion. The phase 2 portion was actually a randomized phase 2 that involved 123 patients, half of whom got pembrolizumab plus first-line chemotherapy with carboplatin and pemetrexed for non-squamous cell lung cancer, and half of whom got standard carboplatin and pemetrexed for non-squamous cell lung cancer. And that study, which was presented last year, showed that there was a clear progression-free survival benefit in patients who got the triplet combination over standard chemotherapy, but there wasn't an overall survival benefit. We know that the majority of patients did cross over and got some type of immunotherapy as second-line therapy. There wasn't also a clear-cut benefit that was seen only in certain PD-L1 subsets, so there was a greater than overall, there was an over 50% response rate in the triplet combination as compared to 29% with chemotherapy alone, and that was true across the board, although there was an 80% response rate in the high PD-L1 positives, those above 50% PD-L1 expression, but it was a very small subgroup. There was actually even a lower than the chemo response rate in the 1 to 49%, but I think we all feel that those small subsets are not necessarily very meaningful. But based on that data, the FDA approved pembrolizumab with carboplatin and pemetrexed for non-squamous cell lung cancer just a few weeks ago. I think it came as a surprise to most in the field because it really was a small randomized phase 2 study, and there is a larger phase 3 study that has actually been completed in terms of accrual. We are now waiting for the readout, which may take another year, but the accrual to that study is actually complete, and I think that was the basis for the accelerated approval that there will be phase 3 data coming out.